The topics of these videos are useful tips and tricks that I've learned in my 20 plus years as a physician. The information in these videos is intended solely for educational purposes and does not in any way replace the necessary and recommended care of a licensed healthcare practitioner. Before sharing what I've used to relieve carpal tunnel syndrome in many of my patients, a word of caution. If you have any neck injuries, shoulder injuries, back injuries, any reason you should not be doing this stretch, or any reason you think you should not be doing this stretch, talk to your doctor or physical therapist before doing this stretch. Here's the stretch that I've used with my patients for carpal tunnel syndrome. Standing in the doorway, you're going to put your forearm up on the frame. The first stretch is your elbow is at shoulder height, and then you're just going to turn away. Hold that for however long feels good. I'm going to make it real short for the video, of course, and then drop it down. Then you're going to even it out and do the other side as well. Once you've got pec major stretched, we're moving on to pec minor. This is the exact same stretch, except that instead of elbow at shoulder height, we are moving elbow up to ear height. And then you're going to turn away, give it a good stretch. Most people feel this a little more in the armpit. Hold for as long as feels good, and then bring it back and release it. Now, once you let your hand down, pay attention to how your hand feels, because almost always you're going to get this really good rush of blood down into your hands as all of this opens up again. So even it out, make sure you always do both sides. You can do this before and or after work. If you're a person who sleeps really clenched up at night and you wake up really tight, do this in the morning before you go into work. And a lot of times people have a little more dexterity through the day and typically a lot less discomfort. The current thinking about the cause of carpal tunnel syndrome is that overuse of the hands causes inflammation in the wrist, which compresses and irritates the big nerve supplying the hand. And sure, that makes sense, especially since that's where the pain is felt. But consider this. These are some of the most common professions that get carpal tunnel syndrome. Besides, of course, using their hands a lot, what other major thing do these jobs have in common? It's their posture. This position leads to shortening of these pectoral muscles, pec major and especially pec minor, which then leads to compression of these blood vessels and nerves that supply the hands. My hypothesis is that the problem is due to compression of both nerves and blood vessels here in the shoulder area. This hypothesis not only makes anatomical sense, it also explains why those two little stretches have given such relief for so many of my patients who had carpal tunnel syndrome. That's it. Leave a comment down below. Let me know if you found it helpful, and I will see y'all next time.